Welcome back to the Deep Dive. Today we are zeroing in on a condition that's, well, it's incredibly common, yet so often misunderstood, it can feel almost mythical.
Polycystic Ovary Syndrome.
Exactly. PCOS. We're calling this one the hormonal hijacker.
And that nickname is spot on. For millions of women, PCOS just creates this kind of chaos in the body. It hits metabolism, fertility, your daily quality of life.
It's staggering.
It is. It affects up to 1 in 10 women of reproductive age, and yet the amount of, misinformation out there is just, it's huge.
Absolutely. So our mission for this deep dive using the material you've gathered is to really stop skimming the surface.
Right.
We need to untangle that hormone confusion.
For sure.
We want to understand the actual mechanism at play and then, explore some of the modern personalized approaches that look to restore balance, not just cover up symptoms.
It's a dive that offers some really essential clarity. I mean, that complexity is often why it gets misdiagnosed. And yet we know it's one of the most common causes of female infertility. So understanding that internal chemistry, that's the absolute first step to managing it.
Okay, so let's start there. Section 1. What is PCOS, really? Because the name itself, Polycystic Ovary Syndrome, is honestly pretty misleading.
It really is. That's the first thing we have to clarify. The name refers to these small, fluid-filled sacs. They're follicles that can sometimes gather on the ovaries.
Sometimes.
Right, exactly. And the material stresses that these cysts are actually just immature egg follicles that never fully matured because ovulation was disrupted.
So they're a result of the problem, not the problem itself.
Precisely. And crucially, you don't even have to have them to get a diagnosis. They aren't present in every case.
So if it's not about the cysts, what really defines this syndrome?
At its core, PCOS is a metabolic and an endocrine disorder. It's something that profoundly disrupts how the ovaries function.
Okay.
And it's an imbalance that's really driven by two powerful interconnected forces.
The two main drivers of the storm. Let's lay those out.
So number one is having higher than normal levels of androgens.
The so-called male hormones, like testosterone.
Yep, testosterone, DHEA. And the second driver, which, this one often acts as the primary engine for the whole thing, is insulin resistance.
And when you get that duo, high androgens and insulin resistance working together, the physical symptoms can be just incredibly wide-ranging. It goes way beyond just reproductive health.
Oh, absolutely. The symptoms are so variable, which is another reason diagnosis can be tricky. You have the classic disruptions to the menstrual cycle.
Irregular periods or super light ones or...
None at all.
Exactly. But then the complexity really deepens when you get into the metabolic effects.
Like the struggle with weight gain that just won't budge, especially around the middle, right?
Or just that intense difficulty losing weight, even when you feel like you're doing everything right with diet and exercise.
And then there are the more visible signs from the excess androgens.
Right, the acne, especially that deep cystic acne or just chronically oily skin. And then the hair changes.
Hirsutism, which is that excess facial or body hair. But then, paradoxically, you also get thinning hair on the scalp, almost like male pattern baldness.
We have to mention the internal struggles, too, the stuff people don't see. The mood instability, the chronic fatigue.
And the fertility challenges, of course, which is what brings so many women to the doctor in the first place.
So the takeaway here is that PCOS isn't just a reproductive problem. It's a systemic, full-body, hormonal and metabolic issue.
That's it. And understanding that variability, that no two cases look exactly alike, is why that personalized testing is so critical. If we just treat the acne, but we ignore the insulin resistance,
you fix nothing structurally.
Nothing.
Okay, that brings us perfectly to section 2. The hormonal chain reaction. This is where we shift from the what to the how, the domino effect the sources talk about.
This is where it gets really interesting.
I think so, too.
Because the whole system is often tipped into chaos by that metabolic piece, the insulin resistance. Most people, they hear insulin and they just think diabetes. But its role here is much more manipulative.
So if your cells are resistant to insulin, your pancreas just keeps pumping out more and more of it to try and get the job done, to clear blood glucose. So you end up with chronically high insulin. How does that signal translate into reproductive chaos?
That is the core link. Excess insulin doesn't just manage blood sugar. It acts as a powerful signaling hormone everywhere. And when those levels are chronically high, it sends a direct signal to the ovaries.
And what does it tell them?
It basically tells the ovaries to produce more testosterone and other androgens.
So excess insulin is essentially hitting a testosterone turbo button on the ovaries.
That's a perfect analogy. And on top of that, high insulin also suppresses something called sex hormone binding globulin, or SHBG.
And that's the protein that cleans up excess testosterone in the blood.
Exactly. So you get this double whammy. The ovaries are producing more testosterone, and there's less of the cleanup crew available to bind it up and neutralize it.
Wow. That is a vicious, self-reinforcing loop. So once the testosterone surges, the whole menstrual cycle is just wrecked.
It's completely disrupted. Ovulation stops or becomes erratic, and then your estrogen and progesterone balance is thrown out of whack. That's where you get the irregular periods and all those physical symptoms we talked about.
And we can't forget the adrenal glands in all this.
Uh-huh.
The source material was very clear about testing DHEA and cortisol.
Yes, and that's not just a technical detail. They are critical players in this whole mechanism.
Okay, so let's pull that in. What's the specific role of DHEA here?
DHEA is an adrenal androgen, so it's made by the adrenal glands, not the ovaries.
Oh, okay.
If your DHEA is high, it's a clue that the androgen excess might be coming from stress or inflammation hitting your adrenals, not just from that ovarian insulin response. It can actually change the whole treatment map.
And what about cortisol, the main stress hormone? How does that fit into this perfect storm?
Cortisol acts like a multiplier. Chronic stress, physical or mental, raises cortisol. And high cortisol directly messes with your glucose metabolism. It drives up blood sugar, which in turn makes insulin resistance even worse.
It's a vicious cycle.
It really is. Stress raises cortisol. Cortisol worsens insulin resistance. Insulin resistance drives up androgens. And all the PCOS symptoms get worse. You have a metabolic disorder that's constantly being fueled by the body's stress response.
So, given all this complexity, that the chaos can start in the ovaries or the adrenals or both, and it's all driven by insulin and stress, you just cannot treat this with guesswork.
Absolutely not. The consensus from all the material is that comprehensive testing is non-negotiable. You have to test everything: estrogen, progesterone, DHEA, SHBG, and definitely cortisol to map out that person's specific hormonal chain reaction.
Which leads us to section 3. Treatment philosophies. Because if the problem is this deep hormonal chaos, then just masking symptoms feels, well, fundamentally inadequate.
That is the exact critique of the traditional treatments. For decades, the standard approach has been really segmented. You get birth control pills to force a period.
Metformin for the insulin part.
Maybe some anti-androgen drugs for the acne or hair growth.
Yeah.
It's all symptom-based.
But the sources suggest that while those things can help symptoms, they almost never address the root cause, that deep hormonal imbalance. They don't restore natural function.
They suppress it. The pill, for instance, it shuts down your ovary's own hormone production and replaces it with synthetics. The symptoms go away, sure, but the body isn't learning how to cycle on its own.
So this is where the alternative approach comes in, bioidentical hormone replacement therapy, or BHRT.
Exactly.
We should probably clarify that term. What does bioidentical actually mean here?
It's all about the molecular structure. Bioidentical hormones are chemically identical to the hormones your body naturally produces, like progesterone or estrogen.
As opposed to synthetic hormones, which have a slightly different structure.
Right. And the key insight is that because they mirror the body's own chemistry, a practitioner can fine-tune the dosages with incredible precision based on that detailed blood work we were just talking about.
So you're aiming for actual restoration, not just suppression.
That's the goal. It's a much more targeted solution for the kind of chaos we see in PCOS.
So what are the specific goals of BHRT when treating PCOS?
Well, a primary goal is often to correct the progesterone deficiency that happens when you're not ovulating. Restoring progesterone is essential for getting regular cycles back, for calming the body, and for stabilizing mood.
And what about the androgen side of it, the high testosterone?
BHRT protocols often work to manage that testosterone excess, sometimes directly, sometimes indirectly. By supporting estrogen levels and stabilizing the cycle with progesterone, you start to regulate the entire endocrine system. The aim is to calm everything down, to move the body out of that constant high androgen state.
So the personalized recalibration, full mapping and correction effort, which is so different from the one-size-fits-all approach.
It is. But it's important to add that the biggest hurdle is still that insulin resistance. Hormone therapy helps with the sex hormones, but to really fix the metabolic trigger, that requires dedicated lifestyle changes right alongside the therapy. It's a joint effort.
That perfectly sets up our final section, section 4. Healing beyond hormones to lifestyle alignment. The material is so clear on this. BHRT or any therapy is limited if the underlying lifestyle isn't addressed.
You can't pour a perfect mix of hormones into a body that's constantly inflamed and stressed out and expect it to work. Your lifestyle choices are either feeding the PCOS machine or they're helping to shut it down.
Okay, so let's break down the 4 critical lifestyle pillars for this hormonal recovery, starting with nutrition.
Nutrition is foundational because it directly attacks that root cause, insulin resistance.
It's all about blood sugar.
All about blood sugar. The focus has to be on stabilizing it and reducing inflammation. That means moving away from processed foods and sugars that spike your glucose and, focusing on whole foods, lean proteins, healthy fats. It's your #1 tool for metabolic control.
Okay, next up, stress management, which, given what we said about cortisol, seems huge.
It's non-negotiable. If you don't find ways to buffer chronic stress, your cortisol levels will just keep reinforcing that domino effect.
Worsening insulin resistance, driving up androgens.
Over and over. Things like mindfulness, breath work, even just dedicated time off, that is literally medicine for your adrenal glands.
Number 3 is movement, but targeted movement, right? Not just burning calories.
That's the key.
Yeah.
The goal here is metabolic. It's to improve your insulin sensitivity. Strength training and steady, moderate cardio are super effective because muscle tissue is more receptive to insulin.
So you're helping your body clear glucose more efficiently.
Exactly. And that lowers the need for all that excess insulin, which reduces the trigger on the ovaries.
And finally, the one that's so often overlooked, sleep.
Sleep is when your metabolic and endocrine systems reset. Even one bad night of sleep can directly impair your glucose tolerance the next day.
Meaning you're more insulin resistant.
Instantly. If you want your hormones to rebalance, you have to prioritize consistent, high-quality sleep. It's not optional.
When you put it all together, the testing, the bioidentical hormones, and then this comprehensive alignment of nutrition, stress, movement, sleep, the message is really about empowerment.
It is.
It's about regaining control over a system that felt completely hijacked.
That's the overarching takeaway. Personalized care is just so crucial because every single case of PCOS looks different. It demands a unique strategy. And this kind of holistic, data-driven approach, it offers real hope that the body can come back into balance naturally.
And it stands in such stark contrast to the frustration so many women face, being dismissed with that oversimplified advice to just lose weight or go on the pill.
Without ever having their actual hormones or metabolism properly mapped out.
Right.
What this deep dive really signifies is a massive shift in how we can approach this. We're moving away from just suppressing symptoms and toward these advanced, personalized plans that use diagnostics, therapies like BHRT, and dedicated coaching to truly bring those chaotic hormones back into alignment.
This has definitely clarified PCOS from being this vague, scary issue into a precise, addressable metabolic and hormonal disorder.
It has. And as we close out, maybe here's a provocative thought for you to consider. Given the critical role that cortisol plays in making PCOS symptoms worse by driving insulin resistance, we really have to ask ourselves, how deeply do the constant demands of modern life, our work pressures, our societal expectations, how deeply do they contribute to or even mask our underlying metabolic health? And knowing that stress is a direct hormonal trigger, what is one immediate, actionable step you can take today to manage those external stressors to support your internal hormonal balance? It's a real challenge to prioritize your physiology over your external pressures.